Welcome back to CTV Morning Live. We are joined by Dr. Lalonde from the Chrysalis Rejuvenation Clinic for your Ask the Expert segments. If you want to give us a call, you can do so on the air, 789-6559, extension 2803. You can always send us a question via Facebook or send us an email to ottawamorning@ctv.ca. Happy New Year.
Happy New Year to you.
Great to see you.
Yep.
All right, so always fun to say, okay, what's the hot topic that we're talking about? We're going with our lasers.
Yes, this month actually we've dubbed January the laser resurfacing month. So two of our major resurfacing lasers, the Fraxel and the Smart Excite CO2. Those are the two lasers that we're going to highlight today. They're indicated for anybody who has issues with either large pores, acne scars, chickenpox scars, surgical scars. They want some tightening around their face, issues of fine lines either around the eyes or around the mouth. Those are all issues that can be attacked by these two lasers. How
do you differentiate between the two? Are they much different in terms of the procedure or how you go about it?
Well, I tell people this way. First of all, if you're dark skin, the Fraxel laser is the only laser you can have because the Smart Excite cannot be done in skin types 4, 5, and 6, which are the darker skin types. So that's one issue. The second issue is the issue of downtime. If you can't afford 6 days of downtime, then you shouldn't have the CO2 because it takes 6 days to recover, a good 6 days. Whereas the Fraxel is a weekend. You have it done on a Friday, you're back at work on Monday, you may be a little red, but you can cover it with makeup. So those are the basic two differences. And the third one, actually, I should add, Fraxel takes it's about a 3-to-1. So if you need two procedures of the CO2, you'll probably need 5 of the Fraxel to achieve a similar result.
Well, I was going to say, if one is requiring that much more, recovery time, is it going deep? Like, why is it taking so much more time for the skin to be able to head out in public?
The actual surface area. The small dots that are involved in those two technologies are slightly different. So the CO2 penetrates a little bit deeper, a little bit wider, and therefore has stronger side effects.
It's always great when we see the before and the afters to really understand what it is that we're dealing with. So we're going to put a couple of shots off, and you'll be able to say you can tell which procedure has been done with each of them. So here's the first one.
Okay, this is a Smart Excite. So this woman in her 60s had issues, as we can see, of lines around her mouth, around the corners of her mouth, on her cheeks. And you can see several months later, I mean, you're not going to see this result in a week or two, but usually at about 3 or 4 weeks, a month, she has a tremendous, I mean, I think it's taken 10 years off her look.
Absolutely, and we're looking at deep wrinkles.
That's right.
With a lot of these. I mean, looking at those cheeks, it's
no, this is what we call a home run. I mean, not everybody gets...
This is a home run, yes.
Not everybody gets this spectacular result. I can tell you that everybody gets a result. There's no question. This is another... You can do both procedures, either Fraxel or CO2 on the hands, and you can see on the left issues of brown pigmentation and also sort of an aged look to the skin. And all of a sudden on the right, you look at a hand that's probably 10 years younger. You know, less brown spots and a slightly thicker looking skin as well. So what these two technologies do is they help stimulate collagen. So you get a thickening of the skin, a tightening of the skin as well. So we have a number of people that come in for this very procedure.
It's so interesting to look at the photographs. I mean, especially looking at a home run like this. At what point do you start to see that for the patient this is something that really bothers them, that it almost affects their self-esteem, and that they're uncomfortable being out in public with the way certain things are happening?
Well, it's all over the map. I mean, some people at age of 35, they come in and they're depressed because they think that they're aging too quickly. But the majority of people is in their 50s. And I think it's a common note that people say, listen, all of a sudden in the last few years I'm really aging a lot. And I don't know why that is, but I think that at some point in time the balance between production of collagen and destruction of collagen, which goes on all the time, is tilted a bit towards more destruction, and that's when we start aging much more rapidly.
I'm looking at this, and you start to see with the way people are exercising and the way people are eating healthier, sometimes the skin is just going to do what the skin wants to do.
Well, there's no question there's a genetic factor, but having said that too, if you look at your mother and you see at what age she started to lose the litheness in her skin, you're probably going to follow the same patterns. But sun is the worst offender. And for those of us who grew up being sun worshippers, I mean, we age more rapidly, no question about it. And that's why the new generation, people are staying out of the sun and protecting their skin, and they're not going to age as rapidly as we did.
So it really is true. It really
absolutely
is true.
true.
So many of us, like, the summer comes and it's like, I just want that sun, I want that vitamin D, I want that color. It's gonna. You don't think it's going to affect you then?
That's
20
right.
years down the
20
road,
years down the road, it does.
It really does.
Yeah.
We're going to have an opportunity for you to ask your questions. Give us an email, give us a call live here on the air. We're going to have a couple more segments with Dr. Lalonde so we can answer your questions. Get a hold of us on the phone, 789-6559, extension 2803. You can always send us an email, ottawa.morning@ctv.ca, or send us a message via Facebook. We're going to take a short commercial break. We'll be back right after this.